Well, if you don't already know it, and maybe you do in your household, we are in the thick of flu, COVID, and RSV season. Joining us right now with this and much more is former FDA Commissioner Dr. Scott Gottlieb. He is now a Pfizer and Illumina board member, also a CNBC contributor. And Scott, let's talk through where things stand. A lot of people probably realize this. They've gotten through the holidays and maybe have had some sickness that have come through their households. How bad is it on a national level?
Well, if you look historically relative to past years, it's not that bad right now. We're probably in the peak season right now with flu and RSV and COVID as well. So we'll probably peak over the next several weeks. Right now, about 5% of all visits to emergency departments are for influenza-like illness. It's higher among kids, so it's as high as 13% for kids age 0 to 4. But overall, it's about 5%. We'll probably continue to go up for the next week or two and then hopefully start to come down with flu A and with RSV as well. The RSV season was a little bit late this year.
So it's maybe just kind of all colliding at the same time because of the later RSV season, too?
Yeah, it's a confluence of things. And RSV usually hits earlier. It's hitting a little later. COVID's starting to peak around the same time. So I think there's a sense that there's a lot of coughs and sniffles around right now, and there are, because all three of those, epidemics are converging.
What about norovirus? I feel like I know some people who have come across with that.
I almost sent you an article that said it was the worst year ever for stomach-borne on cruises. She's got this.
No, I'm not going on a cruise.
I know, but it was the worst year ever. And I thought about you because I would send you some, 15% off.
I don't take cruises, and that's a big part of the reason why.
Yeah,
actually, it's only part of the reason.
We just dealt with this in my household. My 11-year-old had norovirus for 24 hours. So it's 24 to 48 hours. It's spread fecal oral, so people who don't wash their hands in restaurants or don't take good care.
Those two words shouldn't go together, ever.
Not right for breakfast, but, this can spread within a household if you're not careful. It's very easy to spread within a household as well.
Highly contagious.
Right, and it can be very bad. You can have severe vomiting and diarrhea over a 24 to 48-hour period. So if you can't keep fluids down for that length of time, you can get into trouble very quickly if you're older or younger. So it can be severe. We're seeing a lot of it right now. It's an unusual peak of that virus this time of the year. So there's a lot of it going around.
I did read. I was reading up about it. It can't be killed by using those hand sanitizers.
That's right.
You've got to wash your hands, wash them really well for at least 20 seconds, and maybe people should think about that, too.
And it can live on surfaces for a while.
Well, don't pee on your hand. I have like three really...
It's not pee.
It's not pee. It's poop.
Well, okay. I got three really... sensational type things to talk about with you. Can I ask you about these? Is the for-profit model still what we should use for health care after?
Good question.
Because it's a legitimate question because the fire department doesn't try to make money. I still think that for-profit, it does make you mind your P's and Q's, but it does seem to cause people to pull back care that's necessary in certain... I'm talking about the whole United Healthcare.
Yeah, well, look,
how should we fix this, Scott?
When you think about companies like the for-profit health insurers, what they're really doing is implementing plans on behalf of the government and on behalf of employers. So people who don't like the benefit structure, the prior authorization, what they're doing is implementing constraints that are being imposed by the contracts that they have, either with the government agencies like Medicare Advantage or with self-employed businesses that are contracted with them to administer the benefits. So it's really the benefit structure that people are entering into that's imposing those.
Yes and no. Was it just the Wall Street Journal or the New York Times that laid out this huge investigative story taking a look at how sometimes United Health in particular is the one they focused on, but that there were doctors involved who were, and the setup for the doctors involved in their own health care was they had to go through this checklist, and it was set up to try and get you to say that these are that your patient has some really crazy diagnosis before you even saw them. And these happen to be the ones that Medicare paid out the most for.
Yeah, look, the tactics people can take issue with in terms of how the employers are trying to impose cost constraints, but they're imposing those cost constraints on behalf of consumers for the contracts, for the companies they're contracting with.